And I call to order the meeting of the Human Services Committee. Please silence your phones and electronic devices, and at this time, I ask you to please rise for the pledge of allegiance. I pledge
Allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Doreen, could you do roll call, please?
Absolutely. Amo.
Here.
Heller.
Here.
Feller.
Here.
Ravella. Sutherland. Here. Quattell.
Here.
Tui. Ramos.
Here. I know legislator Dewey is here.
Yeah.
but- Okay. All right, so first on the agenda, we have Commissioner of Social Services and Mental Health, Lacey Trimble. I also see Todd here for the monthly report. And I also requested information from the commissioner ahead of budget season and just for awareness of the committee. Given the recent bill passage at the federal level to discuss how the changes in federal funding and eligibility requirements to different DSS services and programs will have impacts on us here in Orange County. And I just want to preface that we don't have all the answers yet, but Commissioner Trimble has prepared like a spreadsheet for us with some of those details. Can I get a motion to discuss?
So move.
Floor is yours.
Would you like to start with the monthly or?
Yes, we can start with the monthly.
So I will abbreviate the monthly report so there's more time for the other piece. Your page 2, temporary assistance really remained constant. The one thing to note on this page is that 58 recipients under employment for June. Brings our year total to 197, and it's the highest number of people who entered employment since January 2020. Our number of individuals on SNAP has also remained relatively constant. June heat payments is lower, which is to be expected this time of the year. Emergency housing placements is also very similar numbers to the previous month. June, there was an average of 20.2 families and 42.9 singles in emergency housing. On page number 5, in June, there were 155 families and 122 singles placed in hotels and motels. 18 individuals served by the Housing Resource Center in permanent housing. So our average year to date is 19.8 individuals per month. This one I'm noting just because we did have a flip and we have extra families in shelters and fewer individuals in shelters in this month. In June, there was a total of 20,496 locally managed Medicaid cases. This again is remaining fairly constant with only a change of 6. Medicaid data is the next table. We are continuing to see the slow downward trend in the total number of cases. However, we are still looking at 2024 data. We have not received any data for 2025 yet from the state. Page 8 is raise the age. The number was 14 total arrests. So we've gone back to kind of our normal from our high end. Page 9, 270 reports of child abuse and neglect investigated in June. 177 were assigned to traditional response, 93 assigned to FAR. Both have decreased since the prior month, which again is normal for this time of year. Foster care services, we provided out-of-home placement to 134 children in June, which is 67 less than June of last year. So our average is considerably lower this year so far than in previous years. Recently had the opportunity to look at a much longer range of data, and this is the lowest we have ever had in the time of big data. It went back 15 years, I think. Maybe 20.
Yes, what's a couple of main factors?
The legislation changes is one. Family First legislation really puts a focus on keeping families together and doing a lot of preventative work before a child is removed, where 20 years ago, children were removed much more readily. So
in place for 2.5 years now? 3 years, I know Darcy was here.
I'd have to look at what
Making sure that
maybe
they,
went in.
I think the work behind it is what started, if you see like, even back in 21, there you see the numbers start going down. If we go back a year or two before that, I think the numbers might have been as high as 400. So
Yes.
it was,
We also are doing some really concerted work with the courts for the last several years, focused on permanency and getting kids who are removed home faster with their supports in place so that they don't remain in care. And I think that's made a difference, just all working collaboratively across systems. Child support, I do want to mention because it is Child Support Awareness Month. So it's a good opportunity to thank our staff who worked so hard to collect and disperse the child support. They served 9,411 cases in June, collected over 3.2 million and dispersed that for a total so far this year of 21.3 million in child support collected and dispersed. Special investigations investigated 147 feds and EDR cases in June. Again, this is for prevention of fraud and abuse. This unit investigated 60 allegations of fraud and abuse in June. 44 cases were determined to have been substantiated fraud. So,
The jump with families in motels over the summer, we have any idea what caused the tremendous jump? That was huge. All I can think of little kids being in one motel.
I don't know what the cause was at this point. I will check with our staff and see if they've seen any trends that have led to that. We are putting a lot of effort into working with those families with the family-centered case management services to try to help them find stability and get out of those hotels more quickly, because we know that's not a good environment for kids, especially as school is right around the corner and, you know, trying to maintain things like homework. I can't even imagine in a hotel room with my children trying to keep up with all of that with all the distractions. So hopefully we'll see some movement in the other direction with the team in place. So what I tried to do with this table, and I'm sorry for the giant paper, I was trying to make it legible for my staff today.
I appreciate your work on this.
And I do want to preface this with that this is what I believe that I know to date. We do not have a lot of guidance from the state yet on how they're going to operationalize these changes. So what I've done to try to help our staff prepare and understand what's coming is look at timeline for when things are happening, what those things mean for us. So the first date you have in there is 7/2025. So the things that kind of went into place immediately. One of those will be a budget impact for New York State with MCOs not being able to be taxed. Part of how the state was looking at filling some of the holes in their budget this year was a tax on managed care organizations. We don't know yet what potential cuts may come from not being allowed to implement that new tax. So that's just something we're watching at this point to see what happens and see what programs might be impacted. SNAP, expanding work requirement time limits, participants must prove they're working at least 20 hours a week. If not, they can only receive SNAP for 3 months and 3 years. Effective upon passage, raise the age for able-bodied adults without dependents subject to work requirements, went from 54 to 64. And dependents used to be 18 and under, and now will be changed to 14 and under. There are all some, there's limited caregiving exemptions, but it does remove the current exemption for veterans, individuals experiencing homelessness, and youth who are aging out of foster care, which used to be exemptions for this program. There were some changes to eligibility. So certain US citizens, nationals, and lawful permanent residents are still covered, but some legal immigrants with humanitarian protections may not be covered now. And again, haven't received guidance from the state yet on how the state's interpreting it or are moving that forward. I'm not sure we'll see big changes from this next two right now, because I know the nursing home really focuses on safety of patients. So the changes in staffing ratios, I don't think we will have as many issues with. In 2026, we're going to see the elimination of expansion for non-expansion states. We have already expanded in New York State, so this one does not hit us, but it does sunset the increased federal medical assistance percentage, or FMAP. for states that expanded their Medicaid after March 2021 and is not allowing for additional FMAP to move forward. October of 2026 is where you see some immigration restrictions begin for lawfully present non-citizens. Currently in New York State, something I learned recently, actually, there are certain immigrant populations who've been present for less than the 5 years mandated before you receive public benefits, who are covered by essential plan services. So not the straight Medicaid, but essentials, which is the Obamacare ACA plans. So this population, there was a lawsuit in 2001 that required the state, based on our constitution, to cover those services for everyone because of the way it's written. And that's where that came from. So that population will no longer be eligible for the essentials plan. There is an estimate out there that some of that population may be eligible for Medicaid, but we don't know yet. The populations that may still be eligible will be certain refugees and asylees, humanitarian parolees, trafficking victims, and people with temporary protected status. This is also the time of year we're going to have to start providing targeted outreach to notify current beneficiaries who will be required to demonstrate community engagement, which is the work requirements, on how to comply and the consequences of not complying. So it's not going into effect, but it will be likely that the counties will be at least partially responsible for making sure that that information gets out to individuals in the community. SNAP will also see some changes in 1026. The federal administrative support for SNAP is currently 50%, and it will be moved to 25%. So the states will be requiring to pay 75% of that total cost for administration. If that total cost is passed on to Orange County, best estimate right now is a $2.1 million cost shift, which would be $2.1 million less revenue we receive to administer that program. And this is where we're required to start planning for the change in error rates that will come further.
What exactly is lawfully present non-citizens? Can you define that?
So they are here. They may be, have sought asylum, but they're not a citizen yet. They may be a refugee from another country. So they're here, they're legally allowed to be here, but they've not achieved their citizenship. So maybe they've sought asylum and they are here on asylum status while waiting for their citizenship process to be completed. There's a few different examples of that.
So for the SNAP benefits, being that the what is it, the dependent age is going on 14, that leaves a gap between 14 and 18-year-olds, right? To
So-
be able to,
The gap would be, so the parent, it would be an exemption gap. So right now, if you have a child under the age of 18, you don't have to meet the work requirements. Now, if your child is 14 and under, you don't have to meet the work requirements, but if you have a 15 to 18-year-old, then you have to meet those work requirements in order to be eligible for SNAP.
okay. Thank you.
And if you flip over on 1226, current regulations, currently the federal regulations prevent work requirements for Medicaid recipients without getting a federal waiver of those work requirements. Very few states have waived that. I believe Georgia has already waived that. New York is not one of those. So in December of 2026, 19 to 64-year-olds who do not have dependents must work or participate in approved activities at least 80 hours per month to qualify for Medicaid. Dependents are defined as children under the age of 14 in this case, so similar to the SNAP rules. It used to be 18. Another big change that is coming is that eligibility will be determined every 6 months. Right now, we determine eligibility once a year.
Can we pause there? Can you, like, what do you think in terms of capacity and, you know, the DSS staff, what does that look like having to determine eligibility every 6 months?
It will be a big workload shift for our staff. I don't know yet what the implications will be for staffing because there are so many shifts. And for example, right now, unless something happened in the last couple of days that I missed, they haven't funded heat yet. So it was zeroed out in this bill. However, there is something that has been moved forward to try to refund. If that moves forward, then I'll still have HEAP staff who need to work on HEAP. If HEAP is not funded, I will have staff that I could potentially shift to help with some of the workload instead of you. So that's part of the unknowns at this point that it's hard to plan for because I don't want to hire in one division and then lose people in another division. I want to be careful that we're making decisions based on, all of the information that we have. If somebody is on SSI, they won't be impacted by work requirements. And anybody who's a new applicant is going to need to document at least 1 month of work activities for enrollment. So again, this is just, preparing our staff for things are going to change in how you process applications, and we need to make sure we're paying attention. In 2027, the enhanced verification goes into effect. Medicaid expansion population renewals will start to be conducted every 12 months, just like the Medicaid ones. Effective for renewals scheduled on or after December 31st, 2026. They're going to start conducting those redeterminations every 6 months for the Medicaid expansion adults as well. Requiring states to obtain contact information on all Medicaid enrollees and to review the master death file at least quarterly to determine if any enrollees individuals are now deceased. So I think that's just shifting some of that. The state will have to have a database that they didn't necessarily have in the past. At the same time for SNAP, SNAP benefits currently are completely federally funded. We have an administration piece as a state that we cover, but the benefit itself from SNAP that goes to the individuals has always been federally funded. States are going to now be contributing to the cost of the benefits based on the statewide error rate. We're anticipating that at least some, if not all of that cost shift would then be shifted to counties. I am working with the state to try to get what our error rate is because we don't know how they calculate it. They did recently send us a document that showed the New York State error rate, New York City versus the rest of state, and then what they called the Big Eight, which is the counties with the highest error rates, which we were not part of, luckily. That is what we don't know how they're calculating yet, but it's how it is looking at. We don't know the definition yet, which would help us then calculate our own error rate if we had a definition. But it is some kind of miscalculation in the benefit, positive or negative. We could have given somebody too much in their SNAP benefits or too little, and we will still be impacted by that error rate. Right now, the highest percentage that a county can pay is 15%, and that's for any state that has a 10% or higher error rate. Right now, New York State, for the most recent data we have, has a 12.35% error rate, which would put us in that highest bracket. If we were actually slightly higher, we would have longer to comply because there is a caveat in the bill for states that have very, very high error rates that anybody above, I think it was a 13.33%, had an extra year to comply with the requirement without having a financial penalty to the state. One of the things that I've been talking to our state representatives about in the different offices we speak to regularly, our liaisons, is that it seems that there might be some conversation about prorating each county's expense based on the county's error rate if we're really widely disparate in what we've done. I do know that we are doing very well. We've made a lot of progress in our timeliness rates, but since I don't know how anything else is calculated, I know we're processing applications fast enough, but I don't have answers to what our error rate is as a county other than we're not in the top 8. Let's see. So we also will see a change in 2027 with what's called retroactive eligibility. So right now, if somebody applies for Medicaid, that Medicaid can cover up to 90 days prior to their application date. So for somebody who is in a hospital and has very expensive emergency room bills and they apply for Medicaid in the hospital, that's covered for them because it's within that 90 days. We ran into that situation a lot in our clinics as well, where somebody may not have their Medicaid in place, but they've proved to us that they've applied for Medicaid. So we know those services will be covered as long as they are approved. And they're aware that if they're not approved, they're going to end up with a bill that they have to pay. So right now we have 90 days. That's going to be reduced. So when you apply for Medicaid, straight Medicaid, it will cover up to 60 days before your application date, starting in 2027. And for the essentials population, it will go back 30 days, where both are 90 currently. So in October of 2027 is when we see the error rates go into effect. And I just put down here the percentage for you so you know which percent. Again, we don't know if it will be fully charged to counties or if it would be partly covered by state, partly covered by county. But if we were in that top bracket, using 2024 numbers, we would think that it would be about a $15 million hit to Orange County. So we're really hoping that that doesn't happen.
Just let me back up to, I think I can ask the question, but go back up to the retroactive eligibility. I understand the principle of it, but what does it mean for the individual that hypothetically comes into the other person? Yes, I apply for Medicaid, and you say, okay, 90 days, 60 after January, say now 90 days, you can provide these services without any payment. All of a sudden, the 91st day, you still haven't been approved. It's all about.
In our clinics, no.
So
In our clinics, we are considered a safety net provider. So our clinics will continue to see somebody even if they can't pay for those services. We would then collect financial information and set a sliding scale fee based on their income, what they can afford.
retroactive 90 days, if they never get.
If they never get it, then we would let them know. They sign a fee sheet in the beginning that lets them know this is your potential risk of coming on without insurance in place.
Nursing home brand, similar problem. A
Correct.
lot of times when somebody goes to a nursing home, it takes them longer to get all the information because the individual themselves is not capable of helping. So it takes longer to get that information. That could be even more problematic to the individual because if they had a month's worth that wasn't covered and it's no longer covered by Medicare either, then they suddenly, have a $10,000 to $15,000 bill that they're going to cover.
That number of patient days in nursing home or any clinic, I mean, buck stops right here at this page. Eventually, the money's gonna come here.
The big thing is at 27.
Yeah, yeah, that's right, yeah, you better be ready for it. When it starts happening, we're gonna pay for it. That's right. Think about a budget.
Legislature.
Do you think, in your opinion, before October 1st, 2027, we will at least be given some kind of criteria of what makes up the error rate? So we have an
Yes.
idea?
Yes, we are asking every chance we get. Even if we have to calculate ourselves, if we know how they're coming up with the calculation, we can pull data from our current systems and try to calculate that and see where we are.
So if you're sitting at 12.5 for the next year, you might as well go 14. That way you're not paying anything.
Yeah. Yes, it's a strange calculation that really, if you're doing worse, you have longer to comply.
But at the same time, the thought is that if you're doing worse, it's going to take you longer to comply. So therefore, well.
And we're kind of right on the line as a state, being about a percentage point.
And likewise, as an individual county, we're on a different line, quite possibly where we could be lower if they do it as your own rate versus the statewide rate. So it's really important to find out which way they're going to
And once they
enforce it.
get the criteria for the error rate, you think these percentages will go up or go down based on where you think they're locked in stone?
The
This is
percentages
national-
are part of the
national.
bill. Yeah, so the percentage is 10% error rate or higher up to that cap of 13.33 is going to give you a 15% expense. I think the thing we're waiting to find out is it going to be solely a county expense or is it going to be split between county and state? And are they going to give everybody a 15% or are they going to look at a county that may have a lower error rate and not split it that way? Because looking at what they've given us so far, New York City, for example, tends to have higher error rates than the rest of state. So we would want to advocate, with our partners at the state to make sure that they at least hear that our staff are doing everything they can to keep those error rates down.
Is that, or weighted, like New York City has 8 million people and we have 400,000 people? Is there a weighting to the whole system when you come up with the bottom line?
I don't know yet. I mean, we don't have a
That,
lot of
yeah, that's what
information.
they haven't explained how they're going to place it upon everybody, so.
You know, our hope is that the error rates will go down, but right now we are at a place where we are at the highest percentage and at risk of having to pay some portion of that. And I will certainly, as I learn things, bring that to this committee so that you're aware of those changes as well.
And just, maybe the question I can phrase it, maybe comment is that the change is so systematic, such system-wide changes, that I don't think we would expect the current staff that we have in social services, which are patient care, delivery, people providing services, to be able to think about how you're going to re-engineer your system if in fact this comes into place. Is the state helping you with that, or should we be thinking the consultant?
So this,
Let me give you all my years with Veterans Mental Health, I can tell you the time when they came into quality improvement director job, which I had. And the whole job was to do things for less. And you have to sit down and re-engineer everything. To think about, well, how can we get that done for less money? Because the state's not going to give it to us. And that became sort of the talking cabinet every week. How do you figure that out? And it takes, but we happen to have a whole central office staff that did that for us. So we had the people to do it. It was a huge task because if this happens, we just can't say this is the way we do business. The only good thing in the thing is they go here from Lawrence today is that the nursing home requirements to eliminate the requirement for staffing. It's an exciting positive news. I don't think there's anybody in the nursing home industry who thinks that you should use minimum staffing as a way to talk about quality. You need to look at triage, you need to look at severity of illness, you need to look at how you staff it, and you need to have the flexibility to move people around the way you want to, and that's what I hear in the industry. But when you put the number in place, you just thought, well, what do you do with it? You're supposed to have 6 people. I don't need 6 today, but tomorrow I might. And they like to have the ability. That certainly may, if nursing home works, it could be a positive.
Yeah, I mean, I think to your point, I think, the eligibility and funding changes inevitably are going to lead to just changes in the staffing and the way that the programs are staffed. So there's going to be a lot of conversations, I think, forthcoming in this committee and Ways and Means in the near future. But continue, we're almost,
and
we're just
to answer the question, I think there will be training offered. I don't know to what extent and what that will look like yet. And I imagine it's going to be work on individual counties' parts as well, to look at process improvement and trying to really, focus on how do we become as efficient as possible with the resources we have. And then just the.
It's an example, just years ago, the clinical people were talking is that just the state came up with a requirement in the clinics that you have to do a treatment plan within 6 months of admission. What one of the clinics in the Arizona health system that is that they found this particular diagnosis had one to stay about 3 months. So you really didn't have to worry about that regulation because it was never going to affect you. You're going to discharge you. And so you laid that out. Oh, that can save me time and money. Now I have fewer things I have to do with the same staff. It's that kind of rethinking and retooling that can we do it a different way? Because maybe there is a different way.
Other major changes in 2028, there will be copays now for some Medicaid services. It's never been allowed to charge a copay for Medicaid before. Those copays will not be in place for mental health or substance use services, which I think is a positive thing because I worry that people would just skip the mental health and substance use services if they had a copay and focus on their primary care. And then in 1029, there's some further verification, which is really more of shifting the process. Because right now we do what's called a Paris match, which looks to make sure that nobody has Medicaid in another state around us. This just expands it to nationwide to make sure somebody doesn't have Medicaid in another state across the entire nation instead of just kind of contiguous to us. So they're looking at, they probably will phase out the Paris match piece once this database is in place for us.
Do you know any kind of data on the recipient getting it from another state that's local to us? Like, is that common or is it?
It does happen. We get a
That's not
report
fraud, or is
periodically.
it- I mean, I don't think that could be a mistake in any way. That's unless it's.
Most of the time when we find a match, the person hasn't used their New York State benefit after they've moved, but they just haven't closed out their case. But when the time, we would see them in the fraud
So they're
numbers
not
that they
actually
had.
getting two sets of benefits.
Yeah, they're not using the benefit even though they're still eligible. But it could happen, so we do check that and we receive the report pretty regularly to check against.
Well, thank you very much. I appreciate all the time that you and everyone helped out bringing this information together for us. This is great. And, you know, as you continue to just learn about different, information, different deadlines, getting some clarity around, you know, the error rate and all that, it would be helpful for us to continue to be in conversation, so that we can continue, you know, having the awareness and knowing what to expect.
We'll have to try
Because
to
these
find a
are-
bigger paper for it.
These are definitely going to have a lot of impacts, I think, again, not just on the services and the programs, but on the workforce as well here in the county, so thank you very much.
Could this be, as changes happen, be included monthly, report monthly update?
Yeah, well, that's what I'm asking, that as things, you know, continue to be updated from the state and or federal level, that we be informed and kept in the loop.
Of course.
Thank you. All right. So next on the agenda, we have Danielle Diana Smith, Director of Office for the Aging. Hello. First report as
Yes, I
Director.
think it is.
Welcome.
Thank you for
Okay.
having me.
So for A, we have a request to accept and appropriate New York State Office of Mental Health Welcome Orange Geriatric Initiative grant funds from the Orange County Office of Mental Health to be used in the current fiscal year. This is for $5,000 and this is legislative request 219. Can I get a motion? Okay. Gorgeous.
So just a little explanation about what WOGI is. I work closely with Lacey and her department on this, but WOGI is, stands for Welcome Orange Geriatric Initiative. It's a triple partnership of aging, mental health, and substance use agencies and supportive community collaborators, striving to increase wellness, independence, and maintain stability in the community for individuals 55 plus with behavioral health and or substance use disorders. So we work very closely with those partners. Mental health is very generous to give us, some funding. It's really for materials, education. We usually get bags, flyers, brochures, really just pertaining to getting the word out about the program. So this usually happens every year. So this year they're nice enough to give us the $5,000 for the rest of this year for the program.
All right. Any questions? All in favor?
Aye.
Any opposed? All right, motion carries. So for B, we have request to accept intermunicipal agreement between the County of Orange and the Town of Chester. These agreements are for new senior and congregate dining centers for 2025. The effective term for the agreement is October 1st, 2025 through December 31st, 2025. This is legislative request 220. Can I get a motion?
So moved.
Second.
So I am trying to just increase our home delivered meal part of our senior dining program as well as the congregate dining sites. Currently, right now, we are in 5 different municipalities throughout the county in terms of our congregate dining sites. We currently operate in the Blooming Grove Senior Center, Greenwood Lake Senior Center, Montgomery Senior Center, St. Paul's Church in the city of Middletown, which is right next door to the Mulberry House Senior Center, and Cornwall Senior Center. Since I've become the director in February, the municipalities of Chester, Highland Falls, Deer Park, and KJ have called, and they're very interested. They recognize a need in their community, and they really want to expand the congregate dining program in their municipality. So Chester is working very diligently, very quickly, very hard. They want to open up yesterday. So this is the first new one. I will be coming to you in a couple months for the others. But this is to open up in the Chester Senior Center. We're going to start 1 day a week on Mondays. And hopefully it grows to 2 days a week. They're thinking Mondays and Thursdays, but right now, as soon as we go through the process, we'll be opening up in Chester. So that's what this is, just to enter that agreement.
Legislator.
Yeah.
For those ones you mentioned.
Yes.
You and I've had a conversation about AJ, but that's not the point. There is a disparity between the amount of money that we pay them and the amount of money it costs the town to run the senior center.
Yes.
That's a lot. There's no sense we're gonna get any money.
We probably won't. Since I've been with the Office for the Aging now 14 years, that funding has always kind of remained the same. I get that same pot of money to use at the discretion to grow this program and to support, both the home delivered and the congregate. Right now, give or take, I mean, every municipality is different, every contract is different. Right now, we're at St. Paul's 5 days a week, we're at Greenwood Lake 1 day a week. So every single one operates very different. But yes, the funding there is greater than what the county is able to support.
Parsing it out
So it's a
into
matter
some
of, correct, and what happened down in KJ was that their other funding sources kind of dried up for them and they haven't been able to come up with a new location. So they're working on it, we're working on it, we have the money available to them. But it really comes down to that municipality having the building, the foundation, the structure, and then we can support the program. Yeah,
Thank you.
you're welcome.
All right. One question, all in favor?
Aye.
Any opposed? All right. Now we move on to C, request to create one part-time courier, grade 5 position in support of the nutrition home delivered meals program. This position will be federally funded, and this is legislative request 221. Can you get a motion?
Second.
So this is the other part of that. In order for me to do that and to grow, the program to these different municipalities, I need a way to get our food and our product there. So if I'm going to, increase it and increase our congregate sites, but then also part 2 is to increase our home delivered meal routes throughout the county. Right now we have 67. But our numbers are growing and the need is out there. So I need couriers in order to do that. So that's what this part-time courier would do, support that and help grow that program.
Any questions? All right, all in favor?
Aye.
Any opposed? And last but not least, we have an update from Office for the Aging. Can I get a moment to discuss?
Yeah.
So moved.
Great.
So I can't believe it's been 6 months. Amory left me in February 1st. So I did the quick calculation. I said, God, I've been doing this for 6 months. First, I just wanted to thank you all for giving me the opportunity, along with the county executive's office, to do this. Like I said before, I worked alongside with Amory for about 13 and a half years. Before that, I ran the Mulberry House Senior Center for almost 3 years. So I thought this transition was going to be easy peasy. I got this. I know the staff. I know the players. This is going to be easy for me. And I was pleasantly surprised. It's big. It's a big job. It's a big position. We have a really great office. I think it was a little bit tough in the beginning because if I was fully staffed, we're a department of 50. And when I took over on February 1st, we were down 11 full-time staff. So the staff is absolutely wonderful. We've surrounded ourselves with great staff that truly go above and beyond. They're there, when they're about to walk out the door at 5 o'clock on a Friday and we get that emergency call that someone doesn't have a meal, they're staying until 6, 7 o'clock without me even having to ask. So we've lucked out with that, but that's probably been the biggest hurdle for me. I was supposed to have, 4 full-time staff in my fiscal department. I was down to 1. who was kind of handling everything, and everybody kind of jumped in. So it has gotten better. I remember for 2 weeks straight, I was there for 9-10 hours, one interview after the other. But we're getting there. I think I'm down to maybe 5 more that I have to fill, so much more manageable. Test results are coming in a lot of it. My hands were tied just with timing of things. Anne-Marie and I are very big proponents of promoting within. Like I said, we have really good staff that come and stay. So every time I promote within, then it's always that backfill. So sometimes I feel like it's that, that spinning of the wheel, but I'm feeling more confident with the staff, really good staff. Dining, as I said, really trying to grow that program. I hope to have 4 new congregate sites open within the next couple of months. We need volunteers. So you'll find in your box after this meeting a little flyer. If you could just put it up or talk about it in your municipalities or in your communities, I really appreciate that. But ever since COVID hit, our volunteer pool has drastically changed, and we just haven't been able to get it to where it was. But we're working on it. We have about 350 volunteers. We used to have 500 volunteers, but we're getting there. So if you could just help with that, that would be great. Right now, the big scuttlebutt is our farmers market coupons program. They're out and about. We have about 200 coupons left. So if anybody needs more or knows of anybody in your community. Okay,
I haven't even.
okay. We were at the senior center, but yes, I will certainly.
Farmers market. I haven't
Okay.
seen any.
Yep. So we have more of that. Again, just looking a little bit in advance, just what's coming down the pike. HEAP will be starting again soon around the winter months. Open enrollment for Medicare happens in October. We'll get ready for our big Adopt a Senior program in the winter. We continue with all of our health promotion activities. So that's our Tai Chi programs and our A Matter of Balance programs and bingo size. They're all our exercise. That's right. I'll get to that. Yep. We also act as the liaison between our office and all the senior centers and senior clubs in the county. So right now we're up to about 24 different senior centers. Within those senior centers, we're up around 65 different senior clubs that meet throughout the county. So I have one full-time staff member that is constantly out in the community, in those centers, in those clubs, in our congregate dining sites, really just promoting our office and all the programs and services that we offer. We try to get into our senior housing units, but we are out and about, spreading all the good things we do. We're still doing our monthly senior games events. And again, we're trying to combat we're still seeing that social isolation, and people are still afraid, to come out. So we're trying to do monthly activities and events to keep people engaged. We still have our Office for the Aging food pantry that we have. It's a very small version, but it's open to any of our clients. A lot of times we supplement our meals that we're delivering. We'll go in the back and, pick some things from our pantry. So that's going good. In the next couple of weeks, we're going to talk about a Go-Go grandparent program. It's to supplement transportation. I'm getting some funding down from the State Office for the Aging, so I'm just waiting on that. They promised me within the next couple of weeks, and then we can push it out. But it's a program that we use in collaboration with Lyft and Uber. And our funding is going to, if we get it, our funding is going to, and if you qualify, about 3 free round trip rides for every client that qualifies. So we're hoping that comes down. As we know, transportation is an issue, especially with the older adult population. So we're really hoping that this Go-Go grandparent will come to fruition in the next couple of weeks. So I'll share that with you if and when it does. I'm trying to think what else. We're still, I would say, I did a quick real call. Up to this point, where we were around 5,800 calls that came into our New York Connects line. So that's where everybody calls for any referral for any program or service. that we offer. And those calls on a daily basis are anywhere from, you know, in-home services, housing issues, food insecurity, transportation, utilities and heat, insurance, home repairs, yard maintenance, isolation and loneliness, caregiver support, legal services. So about 5,800 calls have come in since January. Our RSVP program, our retired senior and volunteer program. I have one staff member that's responsible for that. We have about 400 volunteers that are part of that program. And her job is to take those volunteers and to find a volunteer location throughout the county. We have MOUs with 32 different volunteer organizations throughout the county. So it's working with libraries, it's food pantries, it's in our schools, it's delivering meals, it's helping with our high cap program. But we have 32 different volunteer sites that these volunteers can take advantage of. I think, am I talking too much? Do you have any questions? I could keep
Any
going.
questions?
Our
There's a question.
Oh,
How does the farmer's market coupon program work? Because I just heard about it yesterday and
Yep.
again today.
so the farmer market coupon, we are at the mercy of the state, unfortunately. They give every county X amount of coupons, and we never know how many we're gonna get. This year, Orange County got 3,000 farmer market coupons. So right off the bat, when our county has 83,000 older adults, right away, 3,000 isn't enough. So it always becomes an issue because it's really first come, first serve. So there is, income requirements, Lee, I had it right here, yes. So in order to qualify for a farmer's market coupon in Orange County and in New York State, you have to be 60 years of age or older. And there is a monthly income limit. So for a one-person household, you have to be at or below $2,413 a month. Two-person household, you have to be at or below $3,261 a month. And it's self-declaration. So they're getting this form, they're seeing the requirements, they're signing it, and then they get a coupon. A lot of time, it gets a little sticky. A lot of older adults, they call our office and they say, well, we're homebound. And I think that was a big thing. I guess it was circulating all over Facebook. The Office for the Aging doesn't help anybody. How could you have a senior come into the office to get the coupon? Well, the bottom line is that the senior will have to get to the farmer's market coupon to use it. There is a form that a representative in aid, a family member, whoever can come and sign that. If you have power of attorney or whatever, you can sign if you have permission. But at the end of the day, someone, and it should be the person that the coupon was given to, you have to have a way to get to a farmer's market. We will do whatever we can. We will come to your home if that's easiest. We will do whatever we can to get it in your hand. But the way it's supposed to work is if you're self-declaring, you're signing this form, the coupon should go to you and you should be the one that goes to the farmer's market.
And what does it provide?
And it provides five $5 coupons.
Okay.
So it's a $25 coupon booklet. Not every farmer's market accepts them. Most do. And you can go to the farmer's market and the farmers that take it, you have $25 worth to use. And it could be any
Yeah,
farmer's
the
market in,
The one on Tuesdays in the city of Newburgh, that's
Yep.
right across from the DMV accepts them.
yes.
Yeah, and the DOH has a very
Yes,
same similar
they're,
program.
yep, they help
Yeah.
us distribute and everything, so. It's
Thank you.
it's a really great program and they love it. I just wish we would have one for everybody that qualifies, but
Thank you.
yeah, you're welcome.
Thank you.
You're welcome.
I really appreciate all the
One quick
updates.
question. I'm really sorry, because I got an earful. I'm from Montgomery.
Yeah,
And I'm sure you got an earful from Montgomery.
yes,
So,
yes,
and he makes a bunch of good points, you know, for $25, you have a senior to declare and you go pick up a coupon, $5 coupons, which is great.
Yeah.
Is there any way that, I know most seniors, a lot of us seniors aren't really proficient with the computer or anything, but is there any way that we can get this done online so they can print out the computers, print out the coupons in their home? Is any thought given to this? No?
I don't,
It might work better
it's
than
hard, it
having to
comes
go
down
to-
from the state. We would have to, when they sign the form, they're given the coupon, so I don't know,
I just.
yeah,
I mean,
how if they
the
signed it
point is, you know,
electronically.
he's 80 years old, he's gotta drive to Goshen, pick up 24 hours worth. I got it in one year.
But we did go back for him.
I know.
We went back
I
for
know
him,
you
and we
did.
made it, we made it right for him, but,
He spoke very highly of it.
yes, okay. But thank you. Yes, we will do everything we can,
So many quotes
to
you
do
get,
that,
so you-
but- yeah,
But-
yes.
Well, thank you again. I
You're
really
welcome.
appreciate your time.
You're welcome.
And
Thank
coming
you.
to us with all these wonderful updates.
Yes.
And we look forward to hearing from you soon.
Thank you. I appreciate your support. Thank you.
All right, so last on the agenda, everyone has a copy, and thank you to the legislative team for putting this together. Resolution recognizing September 15th through October 15th, 2025 as National Hispanic Heritage Month. Can I get a?
So moved.
Okay, is there, Chairman, is there anything else that, or do you want to add
You
anything?
could do all at the committee. as
Yeah.
well.
Okay. Sounds good. All right, motion to adjourn.
So move.
Second.